When we talk about research, sometimes it can be overwhelming, especially for students that have never experienced it. Fundamentally, it's asking a question and designing a way to answer it. If you think about medicine, the things that we do today are quite different than what we did 50 years ago. So how do we get there? It's because people stopped and evaluated what we were doing and tried to figure out the best way. So it's an important skill to learn as a medical student, to get involved with things and to apply these techniques.
Research at IU School of Medicine is super broad. There's so many different ways to go about it. You could do data analysis, you could do case reports with a attending physician, and you could even do it online, remotely from your computer, or you could do it in person in a lab. There's so many different options, and just comes down to, are you willing and interested to investigate a topic further?
Research in medical school is extremely invaluable. There's no words to describe it. The way that you'll see yourself grow and change as a future physician by participating in the research process, the things that you will learn and the connections that you will make during the research process are things that you can't learn in the classroom.
Research in medicine sort of gets a bad rap. It's a numbers game for people who are applying to residency. And so it's sort of got this stigma of being a rat race. You got to get your head down, you got to do it, just check that box, and then you'll be to a place where, you can match into a specialty that you want to be in.
Research is so much more than a requirement to get into residency. Research trains your brain how to think critically, how to review complicated literature, and how to eventually apply that in a clinical setting.
So research fit right alongside my medical school curriculum. As I was learning things in the classroom, my research actually enhanced what I was learning and helped me look at the topics through a problem-solving lens.
Research allows you to ask deep questions and think critically about the evidence that you've been presented with. By doing research, thinking critically, thinking about the evidence, you're able to weigh whether or not a standard of care may be truly best for a patient. And it also allows you to identify gaps in knowledge where maybe we don't have the best surgical option for patients currently. You might be able to improve that and push the field forward.
Looking back at my experience doing research at the IU School of Medicine, I'm particularly excited about the fact that some of the research I'm doing could have a direct impact on someone's patient outcomes somewhere out there in the United States or even in the entire world.
As future physicians, we are constantly being pressured to adapt to new guidelines, recommendations, and evidence, but it's extremely important for us to be able to critically evaluate the information that we're receiving and making informed decisions on how it fits within our patient population and can be applied to patient care.
I believe that every student should at least get some experience with research because it goes in tandem with the clinical decision making. You need to be able to think about things creatively and problem solve, which is what research is in a nutshell. Problem solve based off of prior guess.
It can definitely feel overwhelming entering the research process as a medical student who maybe hasn't been that involved with research before. But what I did is I eased into the process. I started working very closely with my mentor who was able to support me and help me through the initial steps. As I got more comfortable with some of the things that I was learning, I was able to really take off and take on projects independently.
Finding research opportunities at a regional campus may seem daunting at first, but for me, it was as simple as reaching out to a professor who had just taught us in class. When I found that I was interested in the material that this professor was talking about during our class, I immediately thought, he's an approachable person. Let me just go ask to see if he has any research opportunities.
So when students are looking for research opportunities, I would encourage them to find a topic that they're very passionate about. Then find a mentor who's equally passionate about that. As faculty, we welcome students in my lab. I enjoy working with them because they have great ideas. Yeah, I really enjoy that process, and I enjoy helping them learn. Especially if it's a topic that's challenging or new to them. So I would say a medical student doesn't need to have any prerequisite skills. They just need to have the passion to learn and be interested in that topic, and to find people around them who are willing to help them grow and learn.
I think that every student should have the opportunity to participate in research during medical school. It's been one of the greatest opportunities that I've ever had throughout my medical and education career.
I would say what surprised me most about research is the connections that I made through the process. So when I was going into the research process, I really thought that it was all about just sitting down and doing the data analysis. You absolutely will do that, but you'll also be presenting your research at conferences and doing presentations.
I often try to tell students that it's not that you're not interested in research, you just haven't found the research that you're interested in yet. There's so many different options available for those who want to get involved in research. There are public health research projects that you can work on, health policy, quality improvement, even education projects. And I think that all of these types of research are very, very important, and they help push forward the field of medicine as a whole.
Biggest thing I can say about research is try it as many times as you want. Try it until the right thing fits, because everybody has a clinical interest. Everybody has an interest in some capacity. That's why we're in medicine. We're curious about how the human body works. And there are still things that we don't quite understand. So don't be afraid to go, fail, try again, fail again.
I would love to see more medical students doing research because I think it's really important to bridge that gap between science and the medical world. I think it's important for physicians to learn the language of science so we can bring new technologies to the clinic. I think this process is super important and has certainly helped me in my career. And I hope that medical students will take this opportunity too.
So for students interested in getting involved with research at IU School of Medicine, I would say just do it. Immerse yourself, make those connections, learn, grow, and the opportunities will follow.
Medicine will allow you to treat the patient right in front of you, but research will help you understand how to treat the next patient after that one. Research can really inform the way you do medicine, and the things you learn in clinic through interacting with patients can inform the research that you do in lab.
I think we're fortunate at the School of Medicine to have so many resources available for medical students for their research journey, from faculty to the librarians that can help you research, write, present, and publish your work. We are very fortunate at the school. And I do think research is a core component of your growth as a medical student to help prepare you for the next phase of life.
We encourage you to take a look into the various resources IU School of Medicine has provided in our efforts to make research more accessible to all members of our community.